Hello everyone. Today I want to talk about one very important myth in early pregnancy scans and also the ultrasound in pregnancy. So the important and most common myth is people they come to us with the positive pregnancy test in a very early pregnancy like 6 weeks or 5 weeks. And they usually, if they had earlier experience also, they usually come up with the experience like the earlier gynecologist has done a transvaginal scan and later she had an abortion. They come to us and in their first time pregnant, they come to us, and if I say that I want to do a transvaginal scan or an internal scan, they say that it might lead to abortion. So that is one very important and most common myth. It is a misconception actually. Transvaginal scan actually helps in the detection of the location of the pregnancy. It helps very well in the assessment of the gestational age, that is a baby growth, and the blood flow to the baby, and also it rules out the ectopic pregnancy and also it helps in the detection of the ovarian cysts and the uterine anomalies in the early pregnancy. So transvaginal scan is a very important scan in the early pregnancy, and it is a myth that it causes any abortion. It does not cause any abortion. If your gynecologist say that they want to do an internal scan, please allow them to do an internal scan. It helps you in a very different way. It gives a lot of information in the early pregnancy and it avoids complications in the early pregnancy. And one more important thing, even I have heard that people, they come and tell that if you do more and more number of scan, is it going to affect the baby in any way? So again, it's a most common misconception. See, ultrasound during pregnancy is very important. So the number of scans which are required in a pregnancy is, one is the dating scan, that is a very early pregnancy, that is the confirmation of the pregnancy, the location of the pregnancy, and whether it is a single baby or the twin gestation. Those all information we get in the first scan, one. And the second is we can see to some extent the uterine anomalies or any ovarian cysts or anything which is there in the pelvis. So because the uterus will be still small, so we can see so many things in detail in the early pregnancy scan. And coming to the next scan, which is done around 8 weeks of pregnancy to see the fetal viability, that is the heartbeat. So heartbeat of the baby, the documentation of the heartbeat of the baby is very important. So if there is no heartbeat, or if there is any problem, or if there is any internal bleeding, which we call it as a subchorionic hemorrhage, so the detection of the subchorionic hemorrhage and its treatment is very important to avoid the complications later on in the pregnancy. And the third scan is a NT scan, that is nuchal translucency scan, which is done at the 12th week of pregnancy. And then the next scan is at the 20th week of pregnancy, which is a detailed anomaly scan. It is also called TIFA scan, that is targeted imaging of the fetal anomaly. So, and the next scan will be around 28 to 30 weeks, which is a growth scan. And then the next scan will be just before delivery to see for the weight of the baby, position of the baby, and the water around the baby. So these are the important scans which are done in the pregnancy when everything else is normal. But if your doctor says, or if they advise any important scans in between also, still there is no harm in doing the additional scans, because ultrasound is a sound wave. It is not going to affect the baby in any way. It does not carry any radiation risk like an X-ray or the CT scan. So ultrasound scanning during pregnancy does not harm the baby or the mother. It is very safe investigation during the pregnancy, just like the blood test. It does not cause any problem to the mother or the baby. In a way, actually, it helps in detection of the early complications. It helps in the detection of the anomalies of the baby. It also helps in the placental localization and the blood flow. So if you have any doubt, or if you want in detail any information, you can please comment, or you can come and visit our center. Thank you.